I have a 58-year-old male electrician with complaints of right shoulder pain and weakness in the right upper extremity, along with intermittent numbness and tingling in the lateral forearm and fingers. This is aggravated by overhead reaching, lifting, and carrying, and eases with rest, ice, and ibuprofen. Key elements in his history include hypertension and a right shoulder arthroscopy, which the long head of the biceps and a slap lesion were repaired. Additionally, he has a history of cancer, night pain, weight loss, and he is a smoker, which all raise suspicions for a potential red flag of a Pancoast tumor. He is currently taking ibuprofen for pain, and his goal is to be able to do overhead activities and fly fishing without limitations. On physical examination, I noted the following. The neuromotor sensory screen was within normal limits, and symptoms were provoked with right shoulder range of motion, inflection, and abduction, and for spinatus tests, Paxonos tests, Neer's test, painful arc, Sperling's functional reach for internal and external rotation, IRST for external rotation, and manual muscle testing for abduction, flexion, and external rotation. Key impairments include cross syndrome, right shoulder weakness, right shoulder range of motion limitations in all ranges, hypomobility inferiorly and posteriorly, and right scapular winging. The history and physical examination are consistent with pain with overhead activities secondary to subacromial pain syndrome. The short-term goal for this patient would be able to decrease pain and increase range of motion by the first and second visit. I would like to refer him to his oncologist for suspicions of a Pancoast tumor, but I would like to treat him today with a grade 3 and 4 supine anterior to posterior glide of the glenohumeral joint and also educate on posture. Do you have any questions before I begin?